This week, I want to go over some commonly used tests for special education eligibility and program. Let's start with the purpose of evaluation. The purpose of evaluation is to provide students, parents, teachers, school psychologists, and all of the other school professionals with the information they need to assist in making decisions regarding how we identify students, program, placement of children, and eligibility for special education services. It's important to remember that a referral for an evaluation means that a student's teacher or a student's parent needs more information in order to better understand how to help that student achieve success at school. If a student is referred for an evaluation, the parent must give permission before any testing can begin. It's important that parents understand why the testing is requested, what areas of learning and development will be assessed by the testing, what types of tests will be given, and how those test results will be used to help the student. The results of the test will be shared with the entire team and the parents once the evaluation is complete. First, we want to look at achievement. Now, achievement tests directly assess students' skills development in academic areas like reading or math or written language. They measure the extent to which a student has profited from schooling or life experiences compared to other students the same age or the same grade. An achievement test gives a global index of academic skill development, and we can use this to identify individual students that may need educational interventions. Achievement tests are most often used to assess students in an effort to identify students who demonstrate low-level, average, or high-level skills in comparison to their peers. Some examples of achievement tests are things like the Woodcock-Johnson Test of Achievement or the Young Children's Achievement Test. Frequently in our area, we use the KTEA or Kaufman test, or different things like the Wyatt, the Wechsler Individual Achievement Test. There are some achievement tests that are used to diagnose a specific skill development area. And examples of these tests would be things like the Gray Oral Reading Test or a Key Math Diagnostic Test. We use the Brigant's Basic Skills Inventory or even the Test of Written Language. We can also use other data like student work samples, we can use observations, and we can use curriculum-based measurement data as well. When we're looking at social communication or behavior, we can also test those areas, things like communication, social interactions. We look for unusual responses to sensory experiences, any impairments with patterns of behavior, if there are interests or activities that are restrictive or sometimes even repetitive or stereotypic. These can include things like rating scales, direct interactions, interviews, and observations. If we want to look at some specific examples for assessments for social communication or behavior, we might look to things like the ADOS, which is the Autism Diagnostic Observation Schedule, or the CARS test, or the Gilliam Autism Rating Scale, or even the Social Responsiveness Scale. We also use cognitive or intelligence tests in our special education eligibility determination testing. A cognitive test is usually administered for the purpose of identifying processing strengths and weaknesses relative to learning. Cognitive testing assesses verbal and nonverbal reasoning, also perception skills, attention, and memory. Cognitive assessments are often called intelligence tests. Individually administered intelligence tests are often used for making decisions about educational placement. An example of a cognitive assessment would be something like the WISC, the Wechsler Intelligence Scale for Children, or the Wechsler Adult Intelligence Scale. We can look at the Kaufman Brief Intelligence Test, the CAS. We can look down this list. We get a lot of different choices. When we want or need to evaluate a student's behavior or emotional levels or personality, we can look at those specific tests that evaluate personality, social emotional behavior, and we compare those across societal expectations. The purpose of assessing social, emotional, and behavioral development is to establish instructional interventions for any areas identified as delayed. Methods commonly used are things like rating scales or self-report measures. We look at situational measures, we look at observational procedures, and technical characteristics. Some examples of assessments in behavior or emotional or personality might include things like the ADDES, which is the Attention Deficit Disorder Evaluation Scale, the Conners Parent-Teacher Rating Scale, or the BASC. We use executive function inventories, things like the Dellis-Kaplan, and even things like functional behavior assessment. When we're evaluating students, we also look at adaptive skills. Now, when we look at adaptive behavior, the primary purpose of this assessment is to determine the extent to which a child performs living skills at age-appropriate levels. Various measures of adaptive behavior usually rely on the observations of a person, like a parent or a teacher, who is familiar with the child. Typically, we assess areas of communication, daily living skills, socialization, and motor skills. Some examples of assessments we would use for adaptive skills would be, the most common I think is the Vineland Adaptive Behavior Scale. We also look at scales of independent behavior, the Adaptive Behavior Assessment System, or the ABI Adaptive Behavior Inventory. And finally, the last area that we look at for evaluation for eligibility and program for students with disabilities is speech and language. Speech tests measure the student's ability to articulate sounds and speak intelligibly. Language tests measure a student's ability to understand and use language. Now remember, this is a quick review from last week. Language consists of syntax, morphology, semantics, and pragmatics. Syntax and morphology refer to the use of accurate sentence structure and word ending like past tense, plurals, possessives, etc. Semantics refers to understanding and use of vocabulary and concepts. And pragmatics is a measurement of how the student uses language to meet social needs. Of course, you'll work with the speech-language pathologist for these types of assessments. The speech-language pathologist will actually complete these assessments, and some of those assessments will be things like the clinical assessment of articulation and phonology, or the Goldman-Fristow test of articulation. Those are some pretty common ones. When it comes to language, again, it's going to be the SLP who will administer these assessments, but things like the Peabody Picture Vocabulary Test, or the BEM test of basic concepts, or the Expressive Vocabulary Test. So those are the types of assessments that you're going to see for speech and language. So again, this was just supposed to be a really brief overview of the purpose of evaluation and an introduction to some of the most common types of assessments that we're going to use in these different areas that are standardized.